What is up with Lucy? She is persistently sad and unhappy no matter what circumstances in her life. Some might say she is depressed. But the most important question to ask here is how to treat her. Aside from therapy, if pharmacological intervention is needed, this is where antidepressants come into play. Well, depression comes under the umbrella of affective disorders. Affective disorders are characterized by a disturbance of mood associated with alterations in behavior, energy, appetite, sleep, and weight. The extremes range from intense excitement and elation, otherwise known as mania, to severe depressive states. Most of the drugs used in the treatment of depression inhibit the reuptake of norepinephrine and/or serotonin. Let us list down the antidepressants we will talk about in this video. We actually talked about the anxiolytic activity of antidepressants in our previous video. Go watch that too to boost your knowledge even further. But here we will only focus on their antidepressant activity. First up, we have the tricyclic antidepressants, can be shortened to TCA. They are older drugs with proven efficacy, but are often sedative and have autonomic side effects that may limit their use. The tricyclics are the most dangerous in overdosage. Tricyclics include amitriptyline, imipramine, dosulepin, lofopramine. Then we have selective serotonin reuptake inhibitors, or SSRI. These are newer drugs that have a wide margin of safety and a different spectrum of side effects. Monoamine oxidase inhibitors, MNOI, are also antidepressants. They are used less often than other antidepressants because of dangerous interactions with some foods and drugs. Some might classify these as reversible selective, which include macrolide. We also have irreversible, including phenelzine and isocarbic acid. A few antidepressants are receptor blockers and do not inhibit MAO or monoamine uptake. Other possibilities include tryptophan, the precursor of 5-HT, and electroconvulsive therapy. A striking characteristic of antidepressant treatment with drugs is that the benefit does not become apparent for at least 2 to 3 weeks. The reason for this is unknown, but may be related to gradual changes in the sensitivity of central serotonin receptors and adrenoceptors. About 70% of patients respond satisfactorily to treatment with antidepressant drugs. If no response is obtained after trying single drugs from different classes, a second augmenting drug can be added, usually lithium. All antidepressants may provoke seizures, and no particular drug is safe for the depressed epileptic patient. Following a response, antidepressant drugs should be continued for at least 4 to 6 months because this reduces the incidence of relapse. Be very careful as abrupt withdrawal of antidepressant drugs, especially MIOI, may cause nausea, vomiting, panic, anxiety, and motor restlessness. The cause of depression and the mechanism of action of antidepressants are actually unknown. But there is a theory that explains the mechanism of action, called the monoamine theory. It is based on the idea that depression resulted from a decrease in the activity of central noradrenergic and/or serotonergic systems. There are problems with this theory, but it has not been replaced with a better one, so this is the best we have got. Okay, what is monoamine theory of depression? Okay, imagine it like this, that there are 2 types of drugs. Firstly, reserpine. It is a drug which depletes the brain of norepinephrine and serotonin, often causes depression. In contrast, the tricyclics and related compounds block the reuptake of norepinephrine and/or serotonin, and the MIOI increase their concentration at synapses in the brain by blocking the monoamine oxidase breakdown of norepinephrine. Both of these actions increase the amounts of norepinephrine and/or serotonin available in the synaptic cleft. So, keeping this observation in mind, monoamine theory proposes that depression is due to a deficiency of monoamines such as norepinephrine and serotonin at certain key sites in the brain. But there are several problems with the monoamine theory of depression. In particular, It has been difficult to understand why the tricyclic drugs rapidly block norepinephrine and serotonin uptake, but require weeks of administration to achieve an antidepressant effect. Also, recent evidence suggests that hippocampal neurodegeneration may be involved in depression. It has also been suggested that the role of raised synaptic serotonin and noradrenaline levels is to induce changes in gene expression and neurogenesis. Such an action could account for the slow onset of the therapeutic effect. Keep watching this lecture as we explore the mechanism of actions of different classes of antidepressants, also learning their adverse reactions and contraindications.
sqadia.com is advancing towards special video series, where we are specifically covering major aspects of pharmacology. Watch out for more subject-related series very soon on sqadia.com.